Patrick Hutzel from intensivecare.hotline.com with another quick tip for families in intensive care. Today's tip is about how we helped a 90-year-old patient in ICU to get extubated after the ICU team wanted to move towards palliation and the withdrawal of treatment pretty quickly, like I've been saying for many, many years. And, after I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and where I've been consulting and advocating for families in intensive care since 2013 here at intensivecare.hotline.com, and where I can confidently say that we have saved many lives, as you can verify on our testimonial section at intensivecare.hotline.com or on our podcast section at intensivecare.hotline.com, where we've done client interviews, and you can verify all the work that we've done. We can build up another case study here, once again, where we helped client's family to get their 90-year-old father extubated after 2 weeks in ICU, where the ICU was pushing towards initially end of life. Then they wanted to do a tracheostomy, and we looked at the medical records, we looked at the ventilators and settings, and we said, no, hold off. Let's keep weaning this gentleman while he's making progress. And lo and behold, after a good 14 days in ICU, he got extubated. He's been successfully extubated in the last 48 hours. And whilst I believe he's not quite out of the woods yet, it goes to show what a second opinion can help with. And it goes to show that if you have someone on your side, a team on your side that can handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong, that quote-unquote miracles or turnarounds can actually happen. But you need that guidance. And if you go just with whatever intensive care teams say, you mustn't forget that they have their own agenda, and their own agenda is often to empty the ICU bed as quickly as possible, which can happen by providing end-of-life care, moving people to hospice or palliative care. That's one way to empty the ICU bed, or the other way to empty the ICU bed is by, doing a tracheostomy and a PEG tube and then sending them out to LTAC. That is predominantly in the US. This is a client in the US, right? And just goes to show that you need to have another set of eyes. And it also goes to show you need to take responsibility for outcomes. It also goes to show you need to take full responsibility for what happens and what questions you ask and who you talk to, And that's what we do here at intensivecare.hotline.com. We help families in intensive care to get results. And results is actually the name of the game. And you also always need to make a distinction between, is this a real or a perceived end-of-life situation? In this situation, clearly it was a perceived end-of-life situation. The intensive care team had the perception that it wasn't a perceived end-of-life situation, nothing more than that. A real end-of-life situation, on the other hand, is if no treatment, no surgery, no equipment, no medications, no nothing can save someone's life, right? That's a real end-of-life situation. I argue the vast majority of quote-unquote end-of-life situations in intensive care are perceived end-of-life situations, simply because 90% of intensive care patients approximately survive. The odds are in your loved one's favor. And because we want to help as many families in intensive care as possible, that's why we created a membership for families of critically ill patients in intensive care. And we have helped hundreds and hundreds of members and clients over the years getting real results for their loved ones in intensive care, getting outcomes, saving lives, prolonging life. All of that is documented on our testimonial section, on our podcast section at intensivecare.hotline.com. And in the membership that we've created, you have access to me and my team 24 hours a day in a membership area and by email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded, helping you to make informed decisions, have peace of mind, control, power, influence, making sure your loved one gets best care and treatment always. And you can get access and you can become a member if you go to intensivecare.hotline.com. If you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me, like I said, and my team, and we answer all questions intensive care related. I also do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, Skype, whichever medium works best for you. And I talk to you and your families directly. And I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also talk to doctors and nurses directly. And when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time. We also do medical record reviews after intensive care. If you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show. And you will get notified for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.